I found that if we were out walking, I would be often many times a long ways from a restroom, and it would just be very, very inconvenient to try to dash to a restroom someplace.
He was probably getting up a couple times in the night. Didn't always wake me up, but the dog always woke up, which would wake me up. So it was making a difference.
Constantly on the lookout for the men's room? Does it seem like it takes forever to get started? Waking up all night long? These are only a few symptoms of benign prostatic hyperplasia, or BPH. Dean was repeatedly waking at night to urinate. All day long he would be in and out of the men's room. His lifestyle and relationship with his wife were affected.
Going to sporting events and concerts were difficult because I had to kind of plan my liquid intake around the times we were going to be there.
Dean is not alone. It's very common for men to develop an enlarged prostate as they age. In fact, BPH is in the top 10 of the most commonly diagnosed diseases in men over the age of 50. More than half of men in their 50s and up to 90% of men in their 70s and 80s experience symptomatic BPH. Although it's not cancerous or life-threatening, it can disrupt life and interfere with a man's everyday living. BPH occurs when the prostate gets enlarged and squeezes the urethra. This pressure on the urethra causes difficulty with urinating. Most men treat this disease with medication, but it must be taken every day for life and is only effective in about half of patients. Medications also come with significant side effects that include potential sexual dysfunctions.
There's also a surgical approach that would require hospitalization, and the traditional procedure would be a transurethral resection of the prostate or perhaps a laser treatment of the prostate. But it often means you're in the hospital for 2 or 3 days and takes quite a bit of time to heal up and get better.
For many men who do not want to spend the rest of their lives taking medications, they search for alternatives outside the pill box. One alternative is Prostiva RF Therapy, an in-office treatment option offered by Urologix. It is a non-surgical procedure which can be performed in less than an hour, is very tolerable, and has a low rate of side effects. Prostiva RF Therapy is a safe, effective, in-office treatment which uses precisely targeted low-level radio frequency, RF energy, that produces heat and destroys excess prostate tissue.
The prostate is anesthetized prior to the procedure. They usually watch the procedure on a video camera and are very interested in the procedure as we do it. It takes less than an hour and is very easily done in the office. That's the end of the procedure. You've done very well.
Patients will be able to resume normal activities shortly after their treatment, and within just 6 weeks, most patients will begin to experience relief from the symptoms of BPH. For Dean, Prostiva RF Therapy was exactly what he was looking for as an alternative to medicating daily.
My consultation with the urologist, he said that because of my experience and the size of my prostate, he felt that the Prostiva was probably the best option for me and would give me the best long-term relief.
They weren't removing the prostate, they were simply causing the prostate to shrink. It was just overall a healthier approach to taking care of the BPH.
Another treatment alternative offered by Urologix is cooled ThermoTherapy, which delivers targeted heat to reduce excess prostatic tissue and relieve the pressure on the urethra. It includes an advanced cooling design to protect the healthy urethra and improve patient comfort.
It is a microwave treatment of directed heat. The catheter generates the heat. It is placed in the prostatic urethra. The procedure takes 28.5 minutes, and it's done under local anesthesia. It's usually very comfortable, and it's usually done for larger prostate glands.
In a third-party survey, Harris Interactive interviewed BPH patients and found 50% were dissatisfied with the effectiveness of their medication. Since 96% of all men being treated for BPH are on prescription medication, this is an alarming statistic. There are also many long-term complications and health risks, which can occur if an individual is on prescription medication for too long. Urologix sponsors seminars to educate and inform BPH patients about the cooled thermotherapy and Prostiva RF therapy options available. They are safe, effective, and have been used by urologists for over 15 years, and both procedures are included in the American Urology Association's BPH treatment guidelines. Medicare and most health insurance cover these treatments. Urologix is also committed to educating physicians. They sponsor professional education events for urologists to show them how these treatments are viable alternatives to chronic medication for their patients. They also co-sponsor educational events for primary care physicians to build awareness for office-based BPH procedures.
Over the last decade, there's been quite a bit of advancement in cool thermotherapy and Prostiva techniques. The older treatments that were done 10 years ago did not work as well. They didn't deliver the heat that is needed, the directed heat that is needed to shrink the prostate tissue up. We now have very good ways. Cool thermotherapy delivers tremendous heat. Prostiva also delivers directed heat right to the prostate. Very effective, shrinking the tissue up, and people are very happy with their results.
Having to stay close to the men's room is a constant nuisance, and interference with intimacy can have a very real impact on a healthy relationship. BPH may not threaten your life, but it certainly disrupts it and interferes with everyday living. Effective treatment options like cooled thermotherapy and Prostiva RF therapy can help a man get his normal life back.
It took probably on the order of 6 weeks to 8 weeks before I felt the full effect of the procedure, full relief from the procedure.
An enlarged prostate caused by BPH can cause serious challenges to a man's daily life that can affect his job, his relationships, and his ability to enjoy life. Cooled thermotherapy and Prostiva RF therapy from Urologix are allowing men to think outside the pill box and get long-term relief from BPH. The procedures only take about an hour, but can have lasting results that positively impact the rest of your life. You can find out more information about BPH and its treatment options at www.beatbph.com. And for more information about Urologix cooled thermotherapy and Prostiva RF therapy, log on to urologix.com.